When performing a necropsy or a post-mortem examination on birds, there are a couple of preliminary things that need to be taken into consideration. First of all, put on a pair of gloves because of the bacterial pathogens that do exist within the digestive tract of the bird. And also the feathers of the bird should be wet down with water and a small amount of detergent added as a wetting agent or disinfectant. This will reduce the amount of dander that is present in the necropsy area and will prevent contamination of your specimens. The bird is opened by making an incision down the midline, and the skin is reflected. It's important to examine the keel bursa because this is a site of inflammation secondary to bacterial infections such as Pasteurella or Mycoplasma. The skin is then reflected. The hips are disarticulated, and the skin is opened past the thoracic inlet to the chin. At this point in the necropsy, we have reflected the skin. We have a clean work site. We can examine the pectoral muscles for symmetry and general conditioning. This pectoral muscle is normal. We can see the thoracic inlet where we can identify the crop. This yellow material is subcutaneous fat, which is normal. Here we can see 1, 2, 3, 4 lobes of the thymus. They are intermixed with the fat in the neck. They are present in the young bird, and they will also be able to be visualized easily in a hen that has been recently molted. The other structures that are easily visualized in the neck include the trachea, and if it is reflected to the side, you can see the esophagus. In meat-type birds, it's especially important to cut through the superficial pectoral muscle to examine the deep pectoral muscle. This will indicate lesions of deep pectoral myopathy if present. It can be very quickly done in this manner. In meat-type birds, it's especially important to reflect the superficial pectoral muscle and examine the deep pectoral muscle. In a bird that is stressed, this muscle may swell and become atrophied, and it may be discolored either yellow or green. The body cavity is opened by lifting the keel and incising into the abdominal musculature. And then the poultry shears is used to cut through the ribs and through the shoulders. At this point in the necropsy, we have an aseptic field. We can visualize both lobes of the liver, the heart, the abdominal fat pad, and if we reflect the heart slightly, we can observe the trachea, the bifurcation of the trachea and the voice box of the chicken, also the great vessels of the heart, and also present in the thoracic inlet is the thyroid gland. There is one on each side of the neck. When examining the abdomen, it's important to first examine the air sacs before any of the organs are disturbed. That can be done by reflecting the liver and pulling it gently to one side, and the air sacs of the abdomen can be observed here on the posterior surface of the lung. This clear membrane is a normal air sac. This bird is a layer, and there is a small amount of fat deposits on the surface of the air sac, but this clear membrane is normal and is what you expect to find.